Hey everyone, it's Dr. Rick, and today's tutorial is on insulin resistance. I was going to do this as a minute clinic for Anne, but it's going to be a little bit longer than usual. I like to keep my tutorials a little longer than my minute clinics, and my minute clinics a little longer than my unboxings. So if this is the first time you're finding me though, don't forget to hit the subscribe button down below and share this with somebody who might be on the fence too, as far as healthy lifestyle. So I will usually, in a primary care clinic, especially mine, we'll usually come across patients who come in and are frustrated with weight loss or having more weight gain despite doing the best they can with nutrition, exercise, proper sleep. So the idea with insulin resistance is that your cells can go on to 103 and live without heart attack, live without stroke, live without cancer, and live past COVID. But the problem is every cell is like a factory, and every factory needs a fuel source. And the typical fuel source is glucose. Glucose is typically generated from carbohydrate, and that's usually the end of the story. The problem is sometimes the average American diet has way too much fuel. And that's not good either. If you take in too many calories, if you take in too much volume, if you take in too much carbohydrate, if you take in sugar, which sugar is not carbohydrate, it might fall under the classification, but sugar is a totally useless molecule that you shouldn't have. Carbohydrate is a useful molecule, but has to be a very important carbohydrate. The crappy carbohydrates that you might find in processed foods are not fuel sources. But regardless, the fuel source is used from your food, and the fuel source fuels those factories to live to 103 and do the typical processes that they're supposed to do, making hormone, making enzymes, making proteins, and then cleaning up the riffraff and reproducing. The problem I feel that average American comes into my office for seeing me is that we get to the point of 40 years of age and we find ourselves, most Americans, a little bit over tipping the scales. Either the waist to hip ratio is dangerous, without getting to the details, waist to hip ratios of greater than 1 are indicative of heart disease, or glucose is too high, or fasting insulin is too high, or hemoglobin A1C is too high, or BMI is too high, or blood pressure is too high. And unfortunately, the thing that's really tricky is that until you turn about 30, you won't feel anything. You'll notice a couple of extra pounds. You might go to the doctor's office for a wellness checkup, and they'll warn you that, hey, your blood pressure is getting a little high, you're borderline diabetes, you have a little bit of a cholesterol issue. But most of my friends won't push too hard until you get to 40 to 50, and then the risk factors have accumulated over a couple of decades, and then it's time to do what? Medicines, which they do help, no question. Medicines do help reverse things quickly, but if you don't change the bad lifestyle, those medicines will have to be cranked up every couple of years until you either have a side effect from the medicine or you go on to have cancer, heart attack, stroke, or in these cases, in modern day times, die from COVID. So the idea is to go backwards to 25 to 30 years of age and then intervene at that point in time. But it's so hard to intervene when you feel good and you're not too heavy and your blood pressure is okay. So how do we anticipate, how do I anticipate what's going to happen later? I go by data. So, and this is where I did a previous video on how the digestive system gets overloaded and how it leads to insulin resistance. So I'll put a link down below, but here's a couple of studies I pulled out that are pretty decent for giving you ideas. I'm going to try to paint these all together, but this is a study out of Stanford, pretty decent. It talks about how even in normal glucose, so glucose can be checked, fasting hopefully, with some blood tests for wellness. But a normal glucose doesn't mean you don't have disease. In fact, the Stanford study showed that people with normal glucose still had insulin resistance. And if you don't pry and get the fancy tests or don't calculate out, you're going to miss it. And then your doctor will tell you, okay, see you in a year or two, you're looking good. So with a family history, with tobacco use, with high stress, with poor sleep, with erectile dysfunction, with hot flashes and dry vagina during or acne, painful menstruation, all those symptoms are sometimes enough to say there's something wrong. Check engine lights on. But if you don't have those symptoms, or if they're mild, then you go by your doctor's office, he gets the blood tests, and if he doesn't find anything with the cursory tests, then you're out of the office. But in my opinion, I try to get as much as possible to check off. And if I have enough checks, I will say, let's pull the trigger. We have to have lifestyle change. So it's important to realize that when you get the standard blood tests, you might, or your doctor and you, because it's a team, might miss insulin resistance. And so why the importance of insulin resistance? This is a study out of 2004 that came up to talk about or to elucidate that insulin resistance usually leads to cardiovascular disease. So it was the insulin resistance atherosclerosis study, and essentially linked insulin resistance with the development of cardiovascular disease. Now, it's not like you have a year of insulin resistance and then suddenly you have a heart attack. It takes time to show that. But by the time it shows, your lifestyle is probably so ingrained, and your bills are high, and your kids are growing up, and your kids are in college, and your business is taking off, that you can't make the lifestyle changes. So it's, again, important to get those lifestyle changes anchored in as you're growing up before the disease takes its anchors. So this was a great study out of Chile. It's more of a review, but if you like pathophysiology and you're a nerd like I am, this is really good. It's kind of thick, and it goes through a lot of metabolism and biochemistry, but it's really nice. And this is 2018, so it's kind of dated a little bit, but it's a review of hyperinsulinemia and insulin resistance. So without going too deep into the weeds, the idea is when you take in too much stuff, you take in too much fuel, you will have a body response. And typically when you have that glucose substrate broken down from your food sources, the glucose goes up in the bloodstream a little bit, and then the pancreas and the other glands in the body realize that. They sense that there's high glucose level in the bloodstream, and then insulin is secreted, because insulin opens the door in every cell to allow the glucose to fuel into the cell. And then it's supposed to stop because the glucose is supposed to go down, insulin's supposed to go down, and bingo, you're good until the next meal. But oftentimes the type of carbohydrate you eat, the stress that you're not addressing, and the volume or the piggyback meals that you might be having, and a meal could be in the form of any fuel source, including Starbucks cafe macchiato latte, whatever it's called. Last time I measured that thing, which some people don't say is a meal, but last time I measured it with the sugar and the carbohydrates, it was like the equivalent of two of my meals. And that means that if you have your breakfast, then you have a cafe macchiato thingy, and then you have your lunch, you actually just had a meal back to back every 3 hours. And that means that in your bloodstream, you've had persistent glucose elevation. And the only thing your body can do is throw out insulin. Because glucose is a fuel source, but too much glucose is irritating. It's irritating to the lining of the capillaries, and that is where you begin cardiovascular disease. Because if you irritate the capillaries go like this. And what happens when capillaries and blood vessels go like this? You get hypertension. What happens when capillaries go like this and they don't work right? You have a transgression, or you have an increase in LDL, you have fatty acids that are produced and turned into triglycerides, high blood pressure, high LDL, all these set up for metabolic syndrome. It used to be called Syndrome X, but it's a constellation of symptoms that you find on a physical exam that increase your chances for cardiovascular disease. So all these things point and lead to cardiovascular disease later on down the line. Again, by the time the doctor educates the patient that here's where you are, it's usually too late. There's damage already. It's not, well, I guess it's not too late. You can always reverse things, but it takes so much to reverse. So, moving forward, yes. So there is also, in addition to checking your waist to hip ratio, your BMI, your weight, your glucose levels, your thyroid levels. I check fasting insulins. So fasting glucose in the morning, fasting insulin, fasting cholesterols are very important. And when you take a fasting insulin level, and a good one is anything less than 12, I actually like 4 to 5. A lot of my patients are in the 20s. That's definitely insulin resistance. Glucose is less than 90, I think, are fair. Glucose is greater than 110, too high, prediabetes. Glucose is greater than 140, that's definitely diabetes. But before getting to that point, you can also do something called a HOMA-IR. HOMA-IR is another measurement that takes your fasting insulin, multiplies it by your fasting glucose, and you divide it by 22.5, I believe, and you get a HOMA-IR. It's just a number, but it's just a number using normal blood tests to figure out if you're insulin resistant. Typically, if I have somebody who has a fasting insulin, I always do fasting insulins. I don't know if my colleagues do that, but I think I get enough metrics to say, this is where we are in time, you're safe, or this is where we are in time, and you got some problems coming. And I'm gonna watch you like a hawk, even closer and more frequent, but until those problems are taken care of. But HOMA-IR is a nice calculation to figure out if you're insulin resistant. Because again, from the first study out of Stanford, people who have normal glucose, and in some case borderline insulin levels, can still be insulin resistant. You have to calculate this stuff. So again, data is beautiful if you know how to use it. This was a pretty cool study. It just goes to show you that sometimes data has to be put into the population. So this is a pretty decent study that showed how, because of waist-to-hip ratio and cultural differences and genetic differences, Mexican Americans have a little bit of wiggle room. So the HOMA-IR, and you got to know the breakdown of different cultures. The HOMA-IR is allowed to go a little higher. 3.8 was what the paper was arguing. I don't want to make this too confusing, but just realize that in addition to a normal glucose, you should have a normal insulin and you should have a normal HOMA-IR. And then you should have a normal cholesterol. You should have a normal triglyceride level. You should have a normal waist-to-hip ratio. You should have a normal BMI. All those things are important. If you don't get those things done, then you're missing out on something. And I will be honest, in my clinic, because we're so pressed for time, we don't usually measure waist-to-hip ratio. We can calculate BMI, but it's such a pain in the butt to get a tape measure and go around the biggest part of the tummy, usually the belly button, the biggest part of the buttock and hip, and then divide it and see where that waist-to-hip ratio is. But it's a very important number, and I think we just kind of flub that and take a glucose and say, you're good, but don't just take that. This was a nice study, as I mentioned before, that sometimes thyroid disease can, subclinical or early thyroid disease can also increase the chances of insulin resistance. Nice, it was a small study, but I wanted to bring it up because the pancreas is a gland, the thyroid's a gland, the adrenals on top of the kidneys are a gland, and your gonads are glands. When all the glands are working properly, you live to 103 without a hitch. You're very productive, you don't feel any problems, you don't suffer. But when one gland goes astray, the other glands have to pick up I always say this, the other glands have to pick up the slack until the first gland is fixed. If you ignore the first gland and it's destroyed or overworked, and then the other glands are working double time, and then you ignore the other glands, then you'll have a constant failure of multiple glands, and then you'll be up shit's creek without a paddle because you just failed so many things. And it's going to be impossible to just take care of one thing and have everything reproduce and get back to normal. So you have to take care of several different things. Very confusing. So it makes it very complicated. So if you take care of things early, when one thing fails or starts to fail or go off the rails, it's much easier to fix than waiting until you're 50. So this was a nice study about, so insulin is a hormone that's secreted from the pancreas, and it affects the way the liver works. It affects the way the fat cells work, and it feeds muscle. It feeds skeletal muscle, also feeds cardiac muscle, also fuels the brain. That's the way glucose works. But fat cells also have their own hormone, adiponectin. So there's a constant balance between what you eat as fuel, how the pancreas secretes insulin, how the cells in the body react to insulin, how the liver unleashes the fuel or keeps it in, and how the fat, which is what fat's supposed to do, fat is supposed to store triglycerides, fatty acids, to use as fuel. I think I read in a study that the cardiac muscle, which is one of the most important muscles in the body, cardiac muscle is very fat adapted. Usually cardiac muscle uses fatty acid more so than glucose as far as its fuel substrate. And fat's supposed to provide that in times of urgency or starvation or exercise. But when you're insulin resistant, the fat and the liver don't work right, and then you screw up on the fuel, and then the heart works double time because there's theoretically no fuel getting to the cell, and that again is the beginning of cardiovascular disease. So you can see how all these things are related to each other, but fat has its own hormone, and when you screw up by introducing too much of a fuel source at the wrong time, constantly, eventually, if you don't pulse this right, eventually, like all American diets, you get into early death or early disability. And in this case of COVID times, you've heard from New York that multiple morbidity or other coexisting problems increase chances for young people to die just as fast as old people. Old people have usually a bunch of medical problems, comorbid conditions. But if you're young and American and I hate to say American, but standard American diet sucks. The standard American lifestyle sucks. But if you have all those things at the age of 40, high blood pressure, heart disease, cholesterol, prediabetes, even if you have medicines that you're supposedly controlling this stuff, you still will fare just as bad as an older person that's somewhat healthy. So fix this crap, because COVID's not going away, and heart disease is still a bigger killer than COVID in the United States. So back to our info. This is just to show that there are medicines that can reverse the medicines used for coronary artery disease or cardiovascular disease can also sensitize cells to become insulin sensitive again. So in case you are insulin resistant, in case you are diabetic, and that's two different things. You don't have to be a diabetic. You can still be insulin resistant. But luckily, insulin resistance and diabetes, insurance will let you see a dietitian and they help you as a coach for nutrition. But if you are on medicines for heart disease, they do some of the medicines, specifically ACE inhibitors, lisinopril, captopril, they will make cells insulin sensitive again. So there is a light at the end of the tunnel in case you do have to be on medicines. It's useful in two regards. Number one, you lower your blood pressure, you help the heart pump, you relax blood vessels, you hopefully will help endothelium heal up, but you also allow some, if not most cells, to become insulin sensitive again. And you get all that crap. It always comes down, you can get all that crap out of the bloodstream, out of from irritating the blood vessels and the heart, but it really comes down to, if you have to use the medicines, cool, but it comes down to the same thing I mentioned at the beginning. You got to have lifestyle changes. And one of the easiest things to do, because the lifestyle change is tough, nutrition is hard to induce. I know a lot of patients that have gone through paleo, keto, vegetarianism, fasting, and sometimes it is an orchestra of different things that have to be done. That's why it's important to have a team of coaches on your team to help you when you falter. Because if you're locking down the calories, if you're doing the fasting and having your your feeding window at a certain time, and you're right on ball, and you're exercising 3 times a week, and you're getting good sleep, and you're meditating, it still might not work. And that's why one coach might have to overlook and see, another coach might have to give their 2 cents. If you have several coaches, you're bulletproof. You should be able to get to where you want to get to really quick. If you do it on your own because you can't find a coach, you don't have a relative, you can't afford it, don't have insurance, you'll get there, but you got to do a lot of reading. I mean, I do a lot of mandatory reading every day, and it is good for going to sleep because it's boring as hell, but data is constantly evolving. It's not that we're changing the concepts, we're just adding to and refining the concepts. So the old concepts from before, they served back then, but more information and science nowadays, and the speed of data is making that fine-tune and getting away the bad stuff, putting in the good stuff, honing down the practices so we can apply it. Scientists are useful. I love scientists, epidemiologists, but doctors are important as being the translators to this information so that it can come to fruition in the patient visit when you come in for a wellness exam. So hopefully this gives you a couple of ideas about how insulin resistance leads to crap, or how insulin resistance can be silent. But don't wait till the last minute, please. If you're having frustration, especially if you're doing everything you can and nothing's happening, or you're plateauing on your weight loss, think of this. Make sure your doctor's checking all these things I mentioned, including those measurements I talked about. And then I bet you'll find a hole in the plan. And if you plug up the hole, the plan will work. But if you have any comments about how you tackled insulin resistance, put them down below. My biggest suggestion, if you want a shortcut in insulin resistance, is fasting and exercise will get you there. Starvation and exercise will get you to lower the insulin by default, but and become more insulin sensitive. But it's painful. I just had a lady go through fasting mimicking diets, a 5-day fast by Walter Longo out of a box. And it was her first attempt. And she was in pain. She suffered. I think because I probably should have introduced components like beta-hydroxybutyrate, MCT oil, a little bit before going deep into the fast so that it wouldn't be so rocky. But those of you who know me, I do a fasting mimicking diet of sorts about every month. And really had to pull it out during COVID times because I've gained 10 pounds, but I think that's more stress and a schedule screw up. But as we come out of this shelter in place slowly, I think, and summer's here, we should really ramp up our health so that we are ready for COVID winter of 2020, 2021, because it's going to be a bad one. So don't just worry about that. Worry about longevity, health span, and again, thanks for subscribing or watching until this point. Send this to other folks if you have anybody that's suffering or puzzled or not having a good doc, and otherwise I'll see you at the next video.